Hello, everyone. This is Colleen Flynn. I'm the Director of National Programs at Build Healthy Places Network. We welcome you on Bridging the Gap, Successful Health and Community Development Partnerships in Practice with our partner organizations, NeighborWorks America, the CaseMade, and St. Mary Development Corporation. Today, we will highlight opportunities for strengthening the connections between health and community development with the long-term goal of improving health and well-being among low-income communities. Here is an outline of our webinar. Next slide, please. We will discuss entry points for collaborative opportunities, motivations and perspectives that community development and health sectors each bring to their work, shared goals across sectors, and successful strategies to make your case for partnership. Next slide. As I mentioned, I'm Colleen Flynn with Build Healthy Places Network. Our mission is to shift the way organizations work across the health, community development, and finance sectors to collectively advance equity, reduce poverty, and improve health in neighborhoods across the United States. As a national center at this intersection, we get to learn about emergent strategies and innovations in partnership. We also build knowledge for collaboration and increasingly work in markets with community development financial institutions and health organizations to bring these sectors together. We're a program of the Public Health Institute. Joining me as speakers are Dr. Tiffany Manuel, the CEO of the CaseMade, Sara Norman, the Director of Healthy Homes and Communities for NeighborWorks America, Tim Bete, the President of St. Mary Development Corporation. Next slide. Some tech housekeeping tips. Please put any tech-related issues in the chat function on the bottom left. You can leave questions or comments for the Q&A portion of the webinar on the bottom right. To view all speakers at once, select Gallery View in the upper right corner. Now I would turn it over to Sara Norman from NeighborWorks America. Sara?
Thank you. It's wonderful to be here today, and I'm really excited to be with this diverse audience of both health and community development practitioners. I'm here from NeighborWorks America. If you don't know NeighborWorks America, we're a national nonprofit that does affordable housing and community development in all 50 states, DC, and Puerto Rico. And one of the most important ways that we operate is with our membership of 240 community development organizations. You'll hear from one of them, Tim Bete, later in the day. So I'm going to share a little bit about reflections on what is motivating collaborations between health and community development. And so I'm going to start on the next slide with, as always, from a health perspective, the evidence base. And I think people have known for many, many, many years the connection between health and housing and community. The evidence is very strong. I think increasingly the evidence base has highlighted that quality housing is important. Yes, we focused on that for many years, public health practitioners, but increasingly understanding that also affordability matters, that stability of housing matters, and fundamentally the neighborhood around you matters. And so I have displayed a series of studies around that on your screen, and if you want more, there's a literature review clicked at the bottom, and you can see that when you do the slides later. And then in addition to affordability and stability, I think one of the things that's really important in thinking about how neighborhoods and communities matter for health is to understand the structure and how that came to place, and the fact that part of these patterns, part of the reasons why certain neighborhoods have higher life expectancy than others is due to historical disinvestment from communities of color and economic and racial segregation. And I think there's an increasing focus on that as well. So that's the evidence base. But when you ask community development practitioners what's motivating them, I think you'll find some interesting answers on the next slide. So NeighborWorks convened a learning community of 5 community development organizations operating in very different markets, very different business profiles. Tim from St. Mary's is one of them. And we asked our members, okay, what's motivating you when you think about these partnerships? And 3 principal things came forward. Social justice, economic impact, and organizational sustainability. So for community development practitioners, social justice was a driver of them wanting to work with health stakeholders to address underlying inequalities between neighborhoods. And then I'll also highlight organizational sustainability. Community development organizations are independent 501c3s. Many are very small, some are larger. And thinking about how they work and partner is a part of thinking about long-term sustainability and being able to serve their communities year after year. So those are three big motivators for community development. And I think it's important for community development practitioners to know what their peers are thinking about, what's motivating their peers, but also for health entities to understand why community development is coming to the table. So finally, we wanted to share who is really the players. Who are the players in the community development sector, and how do we understand them? With that, I'll turn it over to Colleen. Oh, Colleen, you're on mute.
Thank you, Sara. So before we jump in to talk about the community development sector, we wanted to talk a little bit about why healthcare sector is a ready-made partner for community development for various reasons. One is, by conservative estimates, healthcare sector spends $1 trillion annually treating preventable conditions that are caused by poverty, from high flyers in emergency rooms to those suffering from preventable conditions. And these conditions are overrepresented in low-income neighborhoods where patients lack stable, affordable housing, access to healthcare, education, collectively what we call the social determinants of health. Separately, there now payment models for healthcare organizations are shifting from volume to value. So with incentives to achieve better health outcomes, raising awareness of how social determinants of health affect health and well-being. And public health is increasingly focused on population-oriented perspectives. They're focusing on improving neighborhood conditions and poverty and achieving health equity. So we believe that while social determinants of health remain largely outside of the public health and healthcare sector's control, not to mention daunting in terms of capacity needed to address them, we believe the good news is that the health sector doesn't have to do it alone. Community development is ready and can partner with health to make these types of improvements. Next slide, please. So a few words about community development. One, community development is in the zip code improvement business. It's a $200 billion sector investing in social determinants of health in low-income neighborhoods with investments in things like affordable housing, schools, workforce development, health clinics, community centers, and much, much more. Separately, the Community Reinvestment Act that was passed in 1977 as an anti-redlining federal law requires all banks to meet the dispository needs of low-income communities. So this is a helpful tool to be able to work in low-income communities and have money at play. Community development corporations, not to be confused with the CDC in Atlanta, are nonprofit affordable housing developers and community-based nonprofits that invest in neighborhood revitalization. And there are about 5,000 of these local CDCs across the country. Community development financial institutions are private mission-oriented banks, 100% dedicated to delivering responsible, affordable lending to help low-income communities. And there are approximately 1,000 government-certified CDFIs in the US. So as stewards for the communities they serve, the community development sector develops and finances physical spaces, infrastructure, and essential services needed to live a healthy and productive life, and they can really serve as an action arm for advancing health equity. In a report that was designed to increase consensus around the meaning of health equity, since we have lots of different meanings, the Robert Wood Johnson Foundation provided the following definition: that health equity means that everyone has a fair and just opportunity to be as healthy as possible. And this requires removing obstacles to health such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education, housing, and safe environments. So health and community development have been investing for decades in the same places, sometimes with the same people, but not always together. And we believe by working together that these sectors can have more of an impact. Slide.
Thank you, Colleen. Now, to bring this all to the ground, I wanted to share a story from our network, a framework from our network, the NeighborWorks Network of Community Development Organizations. I think one of the things for health entities may understand that there's housing organizations, but may not be familiar with nonprofit housing organizations. And then, furthermore, what does community development very specifically do? And one of the things that we found is using the Social Determinants of Health framework is a fantastic way to explain the diversity and importance of work that community development organizations are doing around the country. So I'm sharing an example from Penquist, which serves many counties in rural Maine. So community development is in rural communities as well as urban and suburban. And this shows how they cut across all the social determinants of health, from economic stability to housing and neighborhood context, health and healthcare, social and community context, and finally into education. And Tim will share a story and sort of using this framework for his organization. It'll look a little different. Some of the services are different and the strategies are different. But again, for community development organizations, this is one great way to explain how you are a one-stop shop for social determinants of health. Okay, Jacob, do you want to head us on to the next slide? So good. So Colleen and I have been talking at a high level, and we really wanted to talk about what does this work look like on the ground? How are partnerships forming? How is the collaboration happening? What does the co-investment look like? And Colleen and I are going to share a few different examples that shows some work that's very early in the incubation phase and some work that's very mature where there's multi-million dollars being invested. So with that, let me go to Northwest Michigan, another rural example. Just again, remember, community development serves the whole country. So let's go to Northwest Michigan Community Action Agency. They were another wonderful member of our NeighborWorks Health Partnership Learning Community, and they have been incubating some projects in collaboration, and that again cut across many different things, from food, and food is medicine, partnering with a hospital, to thinking about how they can improve homeless response, to financial capability and housing couching and how that can improve health. So that's a really important thing that many community development organizations do. They do financial coaching, and they are really deeply committed to connecting wealth to health. So with that, let's take a look at some projects that are further along. Let's go to Champlain Housing Trust in Vermont. They have a deep and long-standing partnership with University of Vermont Medical Center. That partnership has been going on for a bunch of years, but it started with a pilot, and that's how many of these partnerships start. It started with University of Vermont recognizing that many of their patients were actually staying in the hospital not because they needed all the services of the hospital, but because they didn't have a safe, healthy place to go to. And so Champlain Housing Trust did a very short-term pilot, a year long, to understand what would happen if Champlain Housing Trust brought folks into their supportive housing and took care of them and helped them to find long-term housing, but also wrapped around services. And you can see the answer on your screen. This short-term pilot saved $1.2 million and had fantastic outcomes for those folks. This pilot allowed folks to show that the outcomes and the costs were there and has led to 3 more collaborations and co-investment, both in the services and in the housing, the actual bricks and mortar that surround folks from University of Vermont Medical Center. So this is what these collaborations can look like after a couple of years. And we're going to go to Colleen to share some more collaborations.
Thanks, Sarah. So before I go into these project examples, I wanted to just talk a little bit about that there's a range of partnership opportunities between community development and health. And a couple are hospitals and public health departments can offer data support to community development organizations seeking to understand the health of residents in their neighborhoods they serve, and then also for projects' health impact. And another partnership is that hospitals and public health can use their political clout and social standing to help advocate for more affordable housing. In many places, there's opposition by government and residents to build more affordable housing. And to combat this, hospitals and public health departments can harness non-financial assets such as political clout, their social standing, and influence electeds to understand the benefit of affordable housing and how it combats homelessness and helps alleviate some of the health disparities in various different neighborhoods. And now I'll go into some examples. This is Vita in Stanford, Connecticut, and this was a land swap. The Housing Authority gave a site that was adjacent to a hospital for hospital-owned property elsewhere in the neighborhood. The hospital was able to expand its campus, and the Housing Authority had space to build lower density mixed income housing elsewhere. In addition, this deal really planted the seeds for collaboration between these two organizations that are now revitalizing the entire West Side community of Stanford with a central focus on health and wellness. The new Stanford Hospital, Vita, has a mixed income housing, healthcare, thriving businesses, and a huge communal urban farm. $186 million went into the mixed-use neighborhood redevelopment project, and additional $450 million for hospital expansion. And the Housing Authority created 390 units of mixed income housing in 6 separate communities. So this really met the need of both the hospital and the Housing Authority and created quality neighborhood revitalization projects for residents. Next slide, please. Another example is Nationwide Children's Hospital in Columbus, Ohio. In 2008, Community Development for All People, a local nonprofit community development corporation, partnered with Nationwide Children's Hospital in Columbus to form the Healthy Neighborhoods, Healthy Families Reality Collaborative. As part of this collaborative, Nationwide invests in housing redevelopment and thinking about the health of that housing for residents and workforce development. And together, they've already revitalized, they're starting to revitalize and almost complete with revitalizing 31 square blocks around the hospital. They've improved 144 homes, and this includes 46 full renovations and 10 new builds. And the financial investment from the hospital was $4.5 million, so a pretty large investment. In addition, they partnered on the picture that you see, the residences at Career Gateway. This is an urban infill project. It was the site of a former elementary school that was demolished in 2016. This now has 58 units of affordable housing and an on-site job training space for positions at the hospital. And the project also involves local university and other local employers and organizations, and it's become a real center for the community. Next slide, please. The next one that I wanted to talk about is the Alliance for Health Equity. This is across Chicago and Cook County, and it's led by the Illinois Public Health Institute. This is actually one of the largest collaborative hospital community partnerships in the country. There's 30 plus nonprofits, public hospitals, lots of local health departments, and representatives of over 100 community organizations that are serving on action teams. The goal of this collaborative is really to improve population and community health by promoting health equity. They're developing broad city and community-wide initiatives. They're developing joint data system platforms. They're collaborating on policy and advocacy. One thing they did in 2019 is they completed a joint community health needs assessment with all of these different players and key stakeholders providing input. Another thing that was really interesting that they helped to create is a flexible housing pool. This is a partnership between Cook County Health, the City of Chicago, Chicago Housing Authority, and the Housing Authority for Cook County. And the goal there is to rapidly house vulnerable homeless individuals and connect them with housing and support services that they need. What this does is it really creates a mechanism for public and private funding sources that have often been siloed to join toward a common goal with a unified, streamlined funding and service practices. They're looking to expand the flexible housing pool to think about affordable housing and other needs as well. Next slide. I'll now turn it over to Dr. Tiffany Manuel from the CaseMade. Dr.
Great, thanks, Colleen. So welcome everybody. I'm happy to be here. So some of you may know my work working with change makers all across the country to make a stronger case for the very partnerships that we're talking about today, but also for thinking about how we build broader public will around some of these issues and bigger political will. And I would say the reason that this is important in the conversation we're having today is because a lot of these very small sort of piloted programs or partnerships are only small because they lack sort of broader public support and broader public and private resources. So in order for us to get the kind of scale and accelerate that scale that we need, we have to make a case not only to, right, the broader public, but also some of the folks that we need locally to lean in, philanthropic organizations, private sector organizations, et cetera. So I'm here today because I think there's a real catalytic moment in what we're talking about. In fact, I think there are three issues nationally where there's a big catalytic moment. I think one is climate change, the other is housing, but a big push around the social determinants as a whole. And so I think there's a real opportunity for us on this call who are thinking about this issue to understand how we can lean in and get others to do the same. I think especially there's a large issue for those of us who are thinking about the issues of equity and inclusion around some of the larger transformational work that needs to happen around our health ecosystems. In order for us to do that, we have to lean into how we make a stronger case. And I will say for a lot of you, a lot of the work that I've been doing nationally is talking to folks across the country about why and how some of our existing messaging, our framing, and the way that we're engaging some of the partners who we need in this work often backfires. And that's so disappointing when we know that we're trying to do such great work and the partnerships can really result in not just better community health, but can result in better population outcomes. It's frustrating when we're trying to make the case for the partnerships and for this larger push around these issues, and we're not getting the support that we often need. So what I thought I would do today is just to share some examples of what kind of messaging and sort of collaborative case making around some of these issues are working. And before I get to that, a little bit about what is a part of the challenge that's animating some of the issue here. Next slide, please. So I won't have time on the call today to distill some of the social science around what I'm going to talk about today, you can look at that in the book, and I think there's a place at the end for the field guide, which talks a little bit more about why these sort of principles that I'm going to talk about work. Before I get to there, I just want to say, I just want to acknowledge that a part of the challenge that we're having in making the case for the kind of partnerships that we know make a difference is because we're trying to make the case at multiple levels, right? Often what happens is there's some individual champion either in your organization or a community-based organization, and you all are trying, right, to make it, 80 or 90 or whatever it needs to sort of lean into this issue. And so you've got to make the case at multiple levels of scale. And I just want to say that as we think about, the different levels at which we're making the case, that each of these levels, right, of public support and political will kind of has their own sort of cadence and opportunities for collaboration, but also their appetite for data, their appetite for nuance. And so we just have to be really present to the fact that we need to sort of modify the case that we're making to make sure that we're engaging these folks directly. I'd also say, while it's really clear that middle section is for how we influence individual champions, and I would say this is, sometimes it's often the senior level staff in your own organizations. How do you get those folks to really lean into a social determinants approach, or the CEO of your hospital? Sometimes it's the mayor or the city council, where you're trying to have those folks come into this issue because they can be powerful champions. That's one level. The second level is really about those institutions, many of which you all are in and also need to pull in. So people like the YMCA, the United Way, even sometimes the employer associations, they may not be directly important in terms of the services that you provide on the health side or the services that are provided from the housing space, but you need those folks because they also can transform parts of the system that you need to make the juggle and the partnerships work. So making sure that you've got those folks in this conversation is really important. And it's often hard to bring those folks in, one, because they've got their own challenges, right? Those organizations are struggling to keep their own staff afloat. They're struggling to make sure they can provide the services that they provide, or they may not just see it in their own interest as employers, for example, to lean in on some of these issues. So again, We need them. They're gatekeepers that are sort of, that can marshal resources that can help us scale some of this work, but pulling them in is a challenge. And then the last piece is really I would say the hardest piece, and often the piece that gets short shrift in these conversations. Many of you may not see it as your role to lift broader public support for a social determinants approach, but I promise you it really is. We have to begin to lift up public support, even in some of the partnerships that we just talked about around affordable housing. If we're not careful in terms of making sure that we've got public support, even for some of these projects. If you have a great partnership between hospital and you have a great partnership between a housing organization and the public, the broader community around that property will not support it, they can oppose that development. They can add years on to, right, the time that it takes to develop those resources for the population you're working with, because we have not done the work to make sure that they also lean in as well. So what I'd say about that is, that let's call it I was going to say the challenge, but I'll call it the quote unquote the opportunity on the right hand side is that while not everybody may buy in initially to the logic of what you're talking about, there are ways to help people to lean into the work that you do, but it requires us to make a stronger case for them to be able to do that. And us being very strategic about who we're talking to. So if you're talking to a hospital, what are the pain points for that hospital for which that issue around, if you're on the housing side of this, what are the pain points for the hospital that can be powerful animators for them? And if you're on the health side of this and you're talking to a community-based organization, what are the pain points for that community-based organization that can be really drivers for them leaning into what you're doing on the health side of things? So I think, the first sort of key as we think about principles around this is, who are you talking to and what are the pain points for them? And how do we lift that first up in a way that allows us to bring some of these folks in? So I just want to say, the good news as we think about the challenge of speaking to multiple audiences and recognizing that they're not going to be sold just solely by the logic of our case, is that there are ways to bring folks in, and there are principles that attend to that. In one of the slides, I think at the very end, I share the strategic case making guide, where there are some very specific principles that suggest no matter who you're talking to, there are a set of evidence-based principles about how you actually have people lean in, right, to the kind of partnerships we're talking about, even when they have other issues where they may not otherwise do so. Next slide, please. So I thought what might be interesting, just to make sure that we're bringing this down to very specific concrete examples, is just to talk to a couple examples where folks have made a really important, they use some of those principles of strategic case making to help folks to lean in when they otherwise might not have done so. So the first one is a partner, and all of these examples come from NeighborWorks, just to give you a sense of the kind of work that's happening across the organization. The first one is an example of folks who are reframing the conversation and reframing the narrative in the way that I was just talking about. It's very easy where you are sitting, whether you're on the health side of this or the sort of housing side or right, other sectors, it's very easy to communicate from the vantage point of what you know, right, in terms of your own work. But reframing the conversation means looking at the person who's on the other side of the table and starting with the issues that they are facing and connecting those powerfully to the issues that you are talking about. And so here's an example, right, in Hopewell, Virginia, where the community-based organization, NeighborWorks organization, started out talking about what was happening in the community, and we're trying to get a hospital to lean into what a partnership would look like, and they weren't getting much traction. And a part of, I would say, if you look at sort of the case studies, and you can see these on NeighborWorks website, a part of what happened for them was they turned that entire conversation around, and they leaned into what the hospital was facing, the language of the hospital, the challenges of the hospital. They started there and then related all of those challenges to the work they were trying to get done and said, listen, together, like, we'll help you solve your pain point. And when we do that, guess what? It also solves some of the issues for us. So that kind of reframing the narrative of the conversation is really important. Getting inside the specifics of who you're talking to is really important. The second example here comes from Boston. Some of my good friends in Boston who've done a lot of good work around food insecurity in a number of different ways have really gotten very good at, I would say, telling the story of us. And this is really important. Often when we're trying to tell the story of what's happening wherever we're sitting, we tell the story from the vantage point of where we are. We talked about that in terms of reframing. But what I would say is the more promising practices, the better sort of case-making practices are in every story that you're lifting up about the work that you do, you're telling a full-bodied sort of cross-sector or multi-sector story. So if you're telling the story from the vantage point of a community-based organization and the folks who are challenged with housing, you're also talking about at the same time, putting in there a line about food insecurity, something in there about transportation, something in there about services. And while you can't get every single, right, while you will not get every single part of the social determinants in every story, the more you begin to tell those full body stories, the more others in your community can start to see their stake in your success. They start to know how they fit into the work that you're trying to do. And so telling that full body story on a regular basis allow folks to see that and begin to see themselves as part of the work that you're doing early on, even before you approach them with a full body partnership kind of ready to go. They start to see that and even potentially to ask you how they can be more helpful because they see themselves as part of the work that you're trying to build. And we saw that in the Boston Medical Center, which was able to partner with a NeighborWorks affiliate to really think about how they together would solve some of these issues of food insecurity. The final example that I'll share is really anchoring solutions. You know, so often in the work that we do, we talk a lot about what the problems are. And I say this a lot, so many of you have heard me probably say this before. We do so much to just anchor folks in what the problems are, right? Whether it's on the health side, you know, the increasing levels of diabetes or, you know, issues that are health issues that are rampant in the community, or on the housing side, we do so much to talk about so much that's happening in terms of housing insecurity and folks who can't afford rent, et cetera. And a part of what we found that actually works better if you sort of anchor folks in what those solutions are. And I would say from a number of folks, starting with if the solution is a jointly partnered in a grocery store, or the solution is a partnership around providing medical respite care, then you start talking all about the sort of science of that, the importance of that, the aspiration of that. And oh, by the way, when you provide that, it also solves for a whole range of problems that both the hospital, right, may have, or the health institutions may have, and also the community-based organization may have. And so I lift up an example here in Texas where very early on, not only were they tracking sort of data in the way that Colleen was talking about, but they also upfront in the case that they were making started within the case they were making, started with a strong results framework. Like, these are the results that we're driving for, very clearly oriented, have a way to track that data at a level of depth, and then communicating that back out through narrative often so that people can see, again, not just what's happening in terms of progress and the sort of results accountability framework, but here's the good news, they can also see their part in it. They can see the pieces in which they're contributing to their community partners, maybe on the other side of the conversation. They can see, right, their work as part of that. So anchoring folks in what those big solutions are and tracking those solutions over time and making that early on a part of your case making is really an example of great case making and great success. So I'm going to hand it over now, and we're going to have a very specific example and hand it over to, I think, Tim.
Thanks. So what I want to do is just give an example of, from a community development organization standpoint, how using the approaches that you've heard the other experts today talk about has changed us as an organization and the partnerships that we have. So St. Mary Development has been around for 30 years. And for most of that time, we've been an affordable housing real estate developer. We've created 60 multifamily apartment communities and more than 4,000 housing units. And we've always had a very holistic approach. We've attempted to do more than just housing. Over the years, we've had activity programs, transportation programs, food programs within our apartment communities. In most of those areas, we're providing direct services to residents. And to be honest with you, the quality of our work was average. We weren't really experts in those areas. So about 5 years ago, we stopped providing direct services for our residents, and we began a service coordination program. And through the service coordination, we provide case management that connects our residents to dozens of health-related services without requiring us to provide direct services. And we work with over 100 different healthcare organizations and nonprofits to provide those direct services. And this was of greater benefit to the residents because the variety of services provided was so much wider. And examples include things like bringing healthcare providers to the apartment communities, including home health care, visiting physicians, nurse practitioners, and others. By doing that, what we realized, we were able to cover all the social determinants of health areas. Although initially we didn't know we were doing it because 5 years ago we really weren't aware of the whole social determinants concept, but we kind of knew that this was a good thing. While the service coordination was a great addition to our real estate development, when we talked to potential partners about our work, we typically still led with an overview of our real estate development program. And that was fine when we're talking to partners who were interested in real estate development, but it often confused potential healthcare partners. The language we used around real estate development, creating apartment communities, was a communication barrier because it wasn't the language of the healthcare partners, and they often didn't understand it. It didn't show how our work intersected with the healthcare partners' work and how our missions aligned. So that was a significant problem for us. We had many initial meetings that didn't go anywhere. It was kind of like, well, we understand what each other do, but we're not sure where the connection is. And what we really needed was a common language that bridged the gap with the potential partners, and we found that common language in Social Determinants of Health. Next slide, please. So working with a group of other NeighborWorks housing organizations and a healthcare consultant, we began to evaluate both real estate development and service coordination from the perspective of social determinants of health. And it quickly became clear that healthcare networks and other healthcare providers were evaluating their mission and their mission impact, their lines of business in the same way. So we created this common language, and we're able to understand each other's programs a little bit better. One of the things we discovered was we covered all of the social determinant areas. And that was very unusual because we do housing. Housing is one of the hardest social determinants to cover, but we were experts there. And so that what we realized was that made us a fairly unique partner for other organizations. And there was much more interest in working with us than some others because we had this foundation of housing that could be used to deliver healthcare. So we began to look at our real estate development through a different lens. For example, we documented how the design of our apartment communities impacted social determinants beyond just providing shelter. So things like lower rents provide economic stability. Having an on-site office for healthcare providers provides healthcare. Resident meeting spaces can increase social interaction. Other meeting spaces within the buildings can be used to deliver resident education. And even when we looked at things like site selection, we started to view them through social determinants. So we looked at a new prospective site for a building. What's the walkability? What's the access to transportation? So it really wasn't looking at housing as just a place to lay your head at night. It was looking at it as a place to live your life and to deliver healthcare as well, or to create a healthy environment. And so the slide you see there is an example of how we now share our work using the language of social determinants. In addition to this, we created, with these other NeighborWorks organizations, a list of questions to evaluate potential partners and how to determine, are we both committed? Do our missions overlap? Are we looking at the social determinants? And I think Sara will share a link of a draft version of that for you so you can take a look at it, because one of the things we realized is these are long-term partnerships and you have to evaluate them very carefully. You don't want to waste time being 8 months in and realizing this really wasn't the partnership that you thought it was going to be. Next slide, please. So one of the biggest pieces of advice I would give is when you go into initial meetings with potential partners, do it without a fixed agenda. Take the time to really get to know your partner's goal, and as Dr. T said, what are their pain points? If you go into an initial meeting with a specific goal in mind, you're less likely to find that common ground. And often the best partnerships could not have been foreseen ahead of time. So if you go in knowing, hey, we want to ask for these 3 things of a potential partner, it's rushing the whole process, and it's not an effective way to begin a long-term partnership. So I want to share just 2 quick examples of how communicating through social determinants of health really benefited our work. And the first example is about a real estate project that we started a couple of years ago. It was in order to get the project funded, to get a competitive score for a state tax credit funding application, what we needed was a free health clinic within 5 miles of the site. That was one of the criteria that the state scored the project on. So using social determinants and that focus, we partnered with a large free clinic to create a satellite free clinic office near the housing site. And the free clinic organization provided the healthcare professionals, we provided the case managers, and that allowed us to get the competitive score. But through the process, we met the executive director of the Ohio Free Clinic Association, who was impressed with our work. She invited us to become members of the association, and under their definition, St. Mary Development's case management program qualified as a free clinic. And we were kind of surprised about that, but we became members. We later discovered that we qualified potentially for free clinic funding with the work that we did. So that was an added benefit that we had no idea was available. About the same time, St. Mary began to work with other affordable housing providers to create a statewide service coordination network that could be paid for by health insurance companies. And the Ohio Free Clinic Association was interested in the project. They helped become part of the research team and expanded that network. So we went in with one goal. We trying to get that competitive score to get a project funded. We ended up with three things: not only the competitive score, but additional funding and a new partner for another project. The second example is actually very recent. It has to do with our county public health department. I was sitting in a meeting that was unrelated to our work, but the public health commissioner was in there. I introduced myself, mentioned that St. Mary focused on social determinants, again, leading with social determinants, not with real estate, and that I wanted to learn more about the public health department's work on social determinants and what they were focusing on. He was instantly interested in learning more. So we sat down with him, our head of resident services and I, and some of his staff, and we shared some of the questions that we had, not asking him for anything, but we said one of the things that we were looking for expertise in is we want to create a quantitative way to measure quality of life in our residents. And he shared that they are interested in the same thing. Quality of life is important. They're struggling with that. He even shared that they have an epidemiologist on staff, which is something that a housing organization doesn't normally have on staff. So they're doing all kinds of research, and so the conversation will kind of continue there. He also said that their next community health improvement plan will focus solely on social determinants, and he asked us if we'd be interested in becoming part of that process. So this was just an initial meeting. It's unclear exactly where that will go, but this is an important partnership, not because we know where we're going, but we realize that we have significant shared goals. And so now, the conversation will not end. It will continue as we try to figure out what those shared goals are and where they lead us. So the bottom line for me is, if you're a community development organization, begin to communicate your work through a social determinants lens. And if you're a healthcare organization, look at community development organizations as potential healthcare partners and help them see their work through the social determinants lens too.
So now we're going to talk a little bit about different resources that are available as you think more about partnerships and collaborations and projects that you could work on. Next slide, please. Dr. T?
Sure, just happy to say a word about some of the sort of promising practices in case making that we're talking about on the call. I sort of outlined a case making guide. And I think most of all on this slide, I think on the right side, some of those 5 kind of early principles that we're talking about, the we and the why, which is being very cognizant of the pain points of who you're talking to, changing the dominant narrative, telling the story of us, lifting up data as the solution, as an anchor, and then making the systems that you're talking about much more visible in that social determinants approach. So for those of you who are interested in that resource, you can get that on our website. I'll pass it back to Colleen. Thanks.
Next slide. So Build Healthy Places Network also has various resources that we've created through the years that we also wanted to share with you. We developed a new tool. It's a Partnerships for Health Equity and Opportunity. It's a healthcare playbook for community developers. And the goal is to guide community developers toward partnerships with hospitals and healthcare systems. So we think about how to navigate the healthcare ecosystem, which is quite complicated, to understand who are the players and what motivates them. What evidence makes the strongest case for community development health partnerships? How do you start partnerships? How do you develop them? How do you create them? What are some of the barriers for partnerships? And then we give a lot of examples of partnerships that are happening across the country. We also recently developed principles for building healthy and prosperous communities. And our goal and our hope is that these principles will frame and guide efforts across sectors working toward achieving an equitable future, and where fair opportunity is an outcome for all, and that these principles can really help guide those efforts. And then another tool we have is our Jargon Buster. And this Jargon Buster aims to demystify common industry jargon. Throughout community development and healthcare, there's so many words and acronyms that are used, and it really breaks down barriers of conversation. So the goal of this Jargon Buster is to allow sectors to really begin speaking the same language with the goal of advancing collaboration. Next slide. Sara?
Sorry, I wasn't as quick on the unmute trigger as I usually am. Well, thank you for bringing back to me. NeighborWorks America offers a lot of resources and supports for both for housing and for community development and for the health sector to think about how to build these partnerships. I will call out 3 things. One is we are the most common trainer of affordable housing and community development. If you want to know anything about affordable housing and community development, we have a course for you. We have an online training, we have an in-person one, or we can bring it to you. That's one. We happen to be going to New Orleans for our next training institute, which will focus all about this intersection between health, housing, and community development. So join 350 folks for a symposium on health, housing, and community development, and that's part of our training offerings. The second one I want to call out is our network. I think one of the things that's really challenging for health folks is thinking about how to make these partnerships come to fruition, and knowing that not only are there community development organizations and nonprofit affordable housing probably in your community, but there's also state alliances, and there's also national organizations. So if you need to do something at a national scale, come to NeighborWorks America. If you want to do something very locally, you might want to look online at our members and see if there's one serving your community. We obviously have a ton of other tools, resources, and publications, so come to our website, check it out, and I'm sure the conversation will keep going on. Thank you.
Next slide. So now we've entered the Q&A portion of our webinar, and we've been getting a lot of questions, so thank you. It's showing interest. So I will start.
Colleen, for some reason you like to go mute yourself. Oops. And we want to hear you.
Yeah, thank you. So now we'll go to the Q&A portion of the webinar. And we've gotten a lot of great questions, so a lot of people are listening and curious. The first question is to clarify how the funding is actually done with the private sector and what kind of funding mechanisms or types of funding are used to support these partnerships. So I can answer that a little bit, and then if anyone else wants to join in, Sara or others, please do. I thought I would just mention 2 different examples. So one is a new fund. It's Accelerator Fund. It's an $80 million debt funding that's managed by the Low Income Investment Fund. They are a national community development financial institution, and the fund, along with LIF and commercial banks that are also deploying money, and potentially health systems, they're going to offer flexible debt products that are tailored to financing needs for neighborhoods that are implementing the purpose-built community model. I'm not sure if people are aware of that model, but the model works to try to break the cycle of intergenerational poverty by bringing vital components necessary for holistic community revitalization. So this includes high quality mixed income housing, cradle to college education pipeline, comprehensive community development wellness resources. And it's all organized with a single purpose nonprofit community quarterback. So this fund will help support revitalization efforts in the neighborhoods where purpose-built community is working. And another one that I wanted to mention is the Local Initiative Support Corporation, also another national community development financial institution, has joined forces with Morgan Stanley and the Kresge Foundation, and they formed a $2 million Healthy Futures Fund. And the goal with this fund is to finance the development of federally qualified health centers in underserved areas, and also to invest in affordable housing in the same kind of connected area and co-location that incorporates health programs for low-income residents. And the first 100 million of resources has been fully deployed, and now they're working on kind of this next tranche of that work. So there's 2 examples. Do other panelists have thoughts there?
That is a huge question, and I saw a couple of people asking questions about financing. So I'll give you 3 sort of ways of thinking about it. One is, I heard people asking about, okay, where does community development get its funding from? The number 1 source of funding for new nonprofit affordable housing is tax credits. And so that's the number 1 most common source of new nonprofit affordable housing. That being said, people talk about the 13-layer cake, or sometimes the 29-layer cake, to bring it all, and Tim's nodding and smiling. Give him credit for that, because most nonprofit affordable housing comes into play with many, many, many different funding sources, which might include federal funding sources like community development block grants, home, also state and local affordable housing trust funds. And that's just kind of a little snapshot in the housing space. In the health space, I think one of the things that I would divide the health space in terms of these collaborative projects from a financing perspective is I would call out 2 sources. One is, Colleen talked about value-based purchasing, and there are, as a result of sort of new incentives, people are finding ways to be creative around value-based purchasing, especially accountable care organizations, because of the incentives that are applied around better outcomes. So accountable care organizations are one big source. The other way to think about it in the health space is actually investments and endowments. And that might be from health insurance companies or from hospitals, and certainly institutions like Dignity Health, which is one of the largest health systems in the nation, has really set a goal of investing their investments in affordable housing. So, and sort of integrated projects. That is a very complex question. To just add a little bit more fun to the answer, Rethink Health, which is a really interesting organization based in Boston, has come up with a funding typology for multi-sector partnerships that are thinking about about health equity from a social determinants of health perspective. And I can send out quickly a link to that. But also, if you're coming to the symposium, you get a chance to spend some time with them, because obviously I cannot fit in a full answer in 30 seconds.
That was great, Sara. Dr. T or Tim, anything to add?
The only thing that I would add is that without getting into specific funding models, getting to know your partner is getting to know their funding model. Mm-hmm. That's often where the pain points are. And so while we're a faith-based nonprofit, we would rather not get grants. We would rather integrate ourselves in a value-added way to a healthcare partner's business plan. So they love working with us. We're increasing their quality, lowering their expenses, providing more revenue, because that's a long-term solution. And so it's a great question when you're first meeting with somebody and you're looking at pain points, is to find out what are their pain points, because they may have one that you can very easily solve on the financial side.
So that's a great point, Tim. Dr. T, anything to?
No, I think that's exactly right.
Great. So second question, maybe for Dr. T or Tim, is that I believe that people are afraid of crime and bringing new low-income families coming into their small communities. That's a conversation among people here because their resources are already low in a rural area. How do you address this?
So we do it with market studies, and what we show them is that the people who are in poverty already live there. And when we show them that and show them the types of positions that people move in, that these may be school teachers, that maybe they didn't have as big a pension and things like that. And when they realize that the person they're sitting in the pew next to on Sunday at church, and they're at the PTA meeting, these people are already in the communities. And then it seems to them more that this is taking care of my own. The biggest concern we hear is that, well, is this going to attract people in? And we have one rural community, we said, who lives there are people who grew up there and are moving back to retire for the senior community, or they live there already. There aren't many people that decide to move from New York City to upstate New York on a whim to a town of 5,000 people. There's plenty of poverty that's often hidden in those rural areas.
Mm-hmm. Dr.
Yeah, I would absolutely concur with that. I would say that's the same thing that happens, whether you're in a rural area or in a highly dense area, right? The same issues that people think that if you build it, they will come. If you provide these resources and you're going to invite more people in. And so part of the conversation for us is changing that narrative. So when you figure out what are the things that people in that community are actually trying to solve, or what are the challenges that they want to solve, and you connect it powerfully to affordable housing in a positive way, right? They'll lean in very differently. And so what we've tried to do in our work is to show in various communities, what are the things that people want to solve for, that they are so afraid to lose about their own communities, that you can connect that to affordable housing. If you don't invest in affordable housing, you're going to lose the very thing about this community that you love. And so therefore, these things are woven. When you connect the dots in that way, you can get people who never thought they would be talking about affordable housing or supporting affordable housing to come out and be your champions. So I would say, don't give up the fight, breathe, relax, right, and get to work on your case.
Great answer. Another question in a similar vein is, how do we get from shared language and shared mission to shared vision? How many have concluded they wanted a help? Okay, so that's one question. Tim or Dr. T, do you guys want to share your thoughts on how you get from a shared language and shared mission to a shared vision?
I'm not really clear what the question's asking.
I think, well, another part of the question is, how many have concluded they wanted a healthy community, a prosperous community, or a health equity for all? So, how do you get to that shared vision of a healthy community, a prosperous community, health equity for all, when people probably have different priorities and goals, competing things that are going on in their representative organizations? Dr. T, do you have any thoughts there, or Tim?
Yeah, I was thinking, just to piggyback off of what Tim said before, I think it's the value proposition, right? It's the value proposition that helps them sort of come to the table, makes them stay at the table. But the other piece of it is that results framework. When you start to get to work on exactly what the outcomes are going to be and what the benefits are those to all the folks around the table, you get really clear about who's really in it, right, for these particular outcomes, who's really not, right? And so there may be some folks who will back up from the table because that's not what they're leaning into, but you'll get a chance to see that when you front load it with, here are the results that we are creating together. And once you do that, it allows you to sort of be very specific, not just in the generalist language, which is, popular. They're like, we all believe in health equity, until, right, you start to drive to a very specific outcomes. Like, well, I didn't mean that kind of equity, right? That's the kind of equity that requires me to do something. So when you get really, really clear about what's the results framework, then you get people who are really, really in it for those outcomes, and they'll lean in because they see the vision around that. You can create that around that.
Yeah, one thing I would add too is that we've been using mapping as a tool. So really being able to map out the disparities and seeing where there are kind of buckets of poverty and what's going on there, and that resources aren't equally shared, and there's not an opportunity and choice for everyone. And that's helpful in the conversation too. And Tim, did you have something to add?
I was just going to say that some of it depends on who you're talking to as well. So for instance, one of the things that we've started to measure are the tax benefits of our work, because people always say, well, this is going to be expensive. So we recently did an economic impact study of just our service coordination. What we found is we saved taxpayers $38 million over the past 5 years from keeping seniors living independently who would have moved into Medicaid nursing homes. Well, why is that important? Well, we're talking with politicians in some of the communities. Even if they don't buy social justice, they may say, well, that sounds like a pretty good thing for tax savings, where we're able to increase the quality of life and lower taxes at the same time. So a lot of it has to do with just knowing who your audience is and not giving them the wrong message, or the message they're less likely to be interested in.
Great. So I think we'll wrap up with one last question. So the question is there a comprehensive geographic list of partnerships that can be assessed? And so one tool is on Build Healthy Places Network site. We have an area for partnerships where you can go in, and it's a partnership map, and see what community development corporations and other key stakeholders are in your particular geographic area. And then Sara, NeighborWorks America probably has some resources too on your website. Do you want to talk? Yeah.
Sure, certainly you can look at, you can go and look on the NeighborWorks website to find out every community development organization based on location. We have series of stories, case studies, et cetera, and they cover urban, rural, and suburban geographies. So certainly that would be one resource.
Great, thank you. And so, yeah, I think we want to acknowledge that there are a lot of other questions that were mentioned, and that folks can reach out to speakers to get answers, and also that we'll put the webinar online and share the slides after the session is complete. And we want to thank all the speakers. Thank you, Tim, Sara, Dr. T. We really appreciate your time and effort, and thank the audience for listening in and participating with us. It's been a wonderful hour, and we look forward to continuing the conversation. Thank you.